But it's time to do something about this because everyone knows it's needed. They do it secretly now. Doctors do it secretly now. Also, you have spouses where one kills the other and then has to commit suicide because they're afraid of prosecution. These are unnecessary deaths, unnecessary suffering, misery.
How many states allow it?
3 allow it, but it's not allowed right. It's not done correctly.
Meaning?
It's done wrong. It's not a medical service the way it's laid in the law. You don't need a law for this. All you have to say is it's legitimate medical practice. Now you can't pass a law against it. Now it's up to the doctors to set the guidelines like they do with every medical procedure.
Would you have the law state that 2 doctors have to sign off on it?
More than 2. I've already published what you do for it.
What do you want? Give me your law.
Oh, it's in a journal called American Journal of Forensic Psychiatry. I got a detail there, detailed with a hypothetical case.
Okay.
They contact the doctor, and the doctor then finds out what the complaint is. All right, send me your clinical records. Ask your doctor for a copy of your records and send them to me. So we get the clinical records and we see what the patients had, what treatment, what pain control, what works or what doesn't, what the doctor thinks is the problem. And the patient knows the doctor's not going to help him. He knows that. And so it's ineffective. And what we've got to do then...
So what do you want done? How would you do it?
Okay, then we have a consultation with the patient first, especially, and with a spouse if possible, and with the family members, and later on with friends and relatives. All as a one group. We just have a real confab over it. Then we have, the way I laid it out, you break the state up into sections. In Michigan, I did it arbitrarily, 11 sections, 11 zones, I call them. And each one has its own group of doctors that do this.
I see. Doctors who are expert in the end of life.
And it's their specialty. They may do it in addition to their other practice.
What kind of doctor is best suited to do this? What kind of specialty?
It depends.
Psychiatrist, you would think.
You always need a psychiatrist. You can't do it without psychiatric consultation. What we do then is send out, in a certain zone, the doctor who at headquarters sends out, first of all, they pick 2 groups of doctors. I said 3. That's 2 groups of 3. The first group of 3 is the one who debate and discuss and decide on the eligibility for the service.
Then
it goes to the second group of 3, one of whom will be selected to perform it. That way you don't get
I got it.
mixed motives.
And that's it, the third group?
That's just 2 groups, right? And then he will set that group will do what the patient wants. Ask him, do you want it at a hospital, a clinic, or at home?
Right. How long does this process take while the patient may be in pain?
It depends on the disease suffering at the time, the patient suffering.
Can you hasten it?
You don't hasten it, but you do what the patient wants.
Supposing he wants to die tomorrow.
We do it quickly.